plate after last wash on a tissue paper to remove traces of wash buffer content. Add 50 microliters of dengue antigen to each well of the plate. Cover the plate with aluminium foil to prevent evaporation of samples and incubate for 1 hour at 37 degrees centigrade. At the end of incubation, wash the plate 5 times with wash buffer. Tap the plate after last wash on a tissue paper to remove traces of wash buffer content. Add 50 microliters of anti-dengue monoclonal antibody to each well. Cover the plate with aluminium foil to prevent evaporation of samples and incubate for 1 hour at 37 degrees centigrade. At the end of incubation, wash the plate 5 times with wash buffer. Tap the plate after last wash on a tissue paper to remove traces of wash buffer content. Add 50 microliters of Avadine HRP to each well. Cover the plate with aluminium foil to prevent evaporation of samples and incubate for 30 minutes at 37 degrees centigrade. At the end of incubation, wash the plate 5 times with wash buffer. Tap the plate after last wash on a tissue paper to remove traces of wash buffer content. Add 100 microliters of liquid TMB substrate to each well. Incubate at room temperature in dark for 10 minutes. Stop the reaction exactly after 10 minutes with 100 microliters of stop solution. Measure the absorbance at 450 nanometers within 10 minutes after termination of reaction. Quality control. Each kit contains 1 vial of positive control and 1 vial of negative control. These work as markers of kit performance. For the kit used in this demonstration, if optical density of negative control is more than 0.18 or if optical density of the positive control is less than 6 times the optical density of negative control, then in both these situations the test should be considered as invalid. Follow instructions on the kit insert of your kit diligently. In addition to the controls in the kit, it is recommended to include an in-house or a third-party control of known optical density or cutoff value for quality control purposes. The in-house controls can be prepared from pooled test kit controls or made from pooled sera of dengue IgM positive or negative individuals in each laboratory. In addition, a laboratory should also enroll in a regular EQUAS program with a reference laboratory. Interpretation of results. Follow the instructions to read the samples as negative or positive as given on the kit insert of the kit that you use. The kit used in this demonstration uses the following interpretations. If optical density value of sample tested is less than optical density of negative control by a factor 2, that is, sample OD is less than negative OD multiplied by 2, the sample should be considered as negative. If optical density value of sample tested exceeds optical density of negative control by a factor 3, that is, sample OD is greater than negative control OD multiplied by 3, the sample should be considered as positive. If OD value of sample tested exceeds OD of negative control by a factor 2, that is, sample OD is greater than negative control OD multiplied by 2, but is less than OD of negative control by a factor 3, that is, sample OD is less than negative control OD multiplied by 3, the sample should be considered as equivocal. Dengue IgM negative sample is a sample that does not contain detectable levels of dengue IgM and indicates no recent dengue virus infection. But if the clinical symptoms still suggest possible role of dengue virus, the sample should be subjected to dengue NS1 antigen detection, virus isolation, or genome detection, or immunofluorescence studies to show presence of dengue viral antigen. Dengue IgM positive sample is a sample that contains detectable levels of dengue IgM and is interpreted as presumptive dengue infection or a probable case of dengue. Since serological cross-reactivity among the flavivirus group is common, role of other flaviviruses like West Nile and Japanese encephalitis serotypes circulating in the geographic areas must be ruled out. The results must be confirmed by PRNT or fourfold rise in IgG titers of paired sample, or follow the guidelines laid down by WHO from time to time. Dengue IgM equivocal sample indicates that a second sample collected 8 to 10 days after the first sample should be tested for dengue IgM or else by an alternate method of testing should be adopted. Precautions for consistent or accurate test results. Read the kit insert thoroughly before carrying out the test. Do not use kit reagents after expiry. Do not use reagents from a different batch number. Do not freeze any of the reagents. On the day of performing a test, do not bring the reagents to room temperature. Avoid exposure of kit reagents to direct sunlight or higher temperature than recommended storage temperature. Use protective clothing, hand gloves, glasses while performing the assay. Avoid mouth pipetting. If any of the reagents show precipitation, mix it by repeated pipetting. Use disposable absorbent paper or filter paper to cover the working table. Avoid microbial contamination of any of the reagents or cross-contamination of different reagents. Do not use heat inactivated or frozen and thawed sera sample. Incomplete washing may adversely affect the results of the assay. Poor quality distilled water can lead to erroneous results. After washing the wells, add the next reagent immediately as per the protocol. Do not allow the wells to dry. The sera CSF being tested for presence of dengue IgM antibodies are from unknown patients and could be infectious. Handle all samples and the unused kit reagents as infectious. Follow standard guidelines for handling and disposal. Biosafety norms of your institute or medical college must be strictly followed. Avoid contact of skin, mucous membrane, and eyes with any of the reagents. Disposal of unused or expired kit. All the expired kits and reagents are to be decontaminated by autoclaving at 121 degrees centigrade and 15 pounds pressure for 20 minutes. And subsequent disposal of decontaminated material as per local institutional or municipal guidelines. Record keeping. Maintain a logbook for recording of the laboratory specimens. The information contained in the logbook should be kept confidential. A worksheet containing the identification numbers of sera to be tested must be prepared each time before the test is performed. Daily records of temperatures of water baths, refrigerators, and freezers should be maintained. Micropipettes should be calibrated, ideally every 3 months or at least biannually. ELISA readers should be calibrated to ensure accuracy of the readings. Maintain a file where all procedures and package inserts are kept for ready reference. Numbers of ELISA positive samples being reported from various high-risk groups